Senator, thank you so much for being on the DFL Daily with us. We're talking about Medicaid cuts and the continued retribution campaign that Donald Trump has been waging against Minnesotans. Last week, Donald Trump took that next step in the retribution campaign, pausing more than $250 million from Medicaid coming to our state and pausing Medicare enrollments for the next 6 months. Tell us a little bit about your thoughts on that front.
It's the impacts of that are really hard to overstate. And I appreciate your framing of that retribution campaign, because that's exactly what it is. I mean, he has used that exact word. We have been seeing that for the last year, and this is exactly that, the next step in that. And it is going to have real and significant impacts for Minnesotans in big ways. Medicaid, and here in Minnesota, we call that medical assistance, or MA, and that is care and coverage for really our most vulnerable neighbors, people with disabilities, our elders, kids, families, people with low incomes, people who need support and deserve care. It is a program that has, worked well for decades and covers many hundreds of thousands of Minnesotans to, provide them the care that they need and deserve. And of course, Medicare, people are probably familiar with as well, ensuring care for our elders, for our families and friends and neighbors. And so, these cuts are significant. It is going to mean that people do not get the care that they need and deserve. And it is so wrong that his grievances are affecting Minnesotans in that way.
The healthcare already costs way too much. It's already not affordable. This is only going to increase that problem, the affordability crisis that Minnesotans are feeling the squeeze from right now. How extensive will this additional withholding of funds be on kids and seniors, the most vulnerable in Minnesota?
Yeah, I mean, the dollar amount is, significant. It is going to have real and significant impacts for folks. And, I just want to be clear that it is not only folks who are on Medicaid or Medicare that are going to be affected by this. We know that just because people don't, no longer have health coverage, it doesn't mean they don't need health care. And so they are still going to need care. They likely, potentially will put it off. They're not going to get preventative care. They're not going to be able to, make an appointment with their doctor. They will, unfortunately, probably wait till they are sicker and end up in an emergency department where care is even more expensive and there's not capacity. Our emergency departments are full now. So that is going to just, exacerbate that problem. And so that, care is just going to be more expensive, and it is going to cause ripple effects. It is going to increase the cost of care for all of us. The other thing I would say in terms of like the details, how is this going to work? What is exactly will it mean? As with many of the actions of this administration, there's not always a lot of details shared initially. We get sort of a tweet or a memo or a YouTube video or, whatever it may be, where they just sort of throw something out there. And then we wait for the details and the follow-up. And it is not the way to govern. And it, again, is just going to have real and significant impacts for Minnesotans in really harmful ways.
More than 1 million Minnesotans rely on Medicaid for essential health services, including mental health and addiction treatment. How is this going to impact mental health? I don't think a lot of people realize that it'll impact that as well.
Absolutely. At a point where we are really at a crisis point with that. I mean, we have significant mental health needs across the state. And just as you said, these, coverages for, over 1 million people provide a way for people to get the mental health care that they need. Again, in a time when it is so necessary, this is going to have impacts on that. It's going to mean that people will not get mental health care.
Many families use Medicaid on top of private insurance, especially people with children who have high needs or folks with higher risk for serious illness. How will cutting Medicaid affect day-to-day life for working families and children who rely on this program?
Yeah, it's going to mean that people are going to have to make more difficult choices. It's going to mean that people don't get the care and appreciate the underscore of that. This, again, with particularly medical assistance, we are talking about vulnerable neighbors, kids with disabilities, families, elders, people who need and deserve care. And it will absolutely mean, those families are going to have to make tough choices that, families are already feeling squeezed in many ways. The cost of healthcare, which we have talked about, on top of groceries and housing and childcare. This is going to make all of that worse when they no longer have, access to the coverage for the care that they need.
Absolutely. Cutting Medicaid isn't going to obviously stop people from getting sick. You've already pointed out they're just going to have to go to the emergency room when they do need that care, and they're going to be sicker when they do. It's going to create a squeeze within the entire system, making healthcare more expensive for everybody, even people who aren't using these programs. What are you hearing from your constituents about all of this right now? You represent, rah, rah, Rochester, as I like to call it. How are people making sense of
Yeah.
this?
You are exactly right. And in Rochester, the Med City, many folks are healthcare minded. And I hear about this often, every day, honestly. People are very concerned, both about, for their neighbors and their families, about what it means for people to lose care. Because we don't want that. We want everyone to be able to get and receive the care that they need in affordable ways. But also the impact that it is going to have on our healthcare system, which is already under incredible pressure. And so that's, one thing for Rochester and urban spaces, but it's another thing for our rural hospitals, who are really in a very, very difficult position. And, this cut comes on top of many other cuts that we have seen previously. And so that is going to have, in particular, very devastating impacts on rural healthcare and people's ability to access care, and the ability for those hospitals and clinics to be able to stay open. If they, are not receiving reimbursement for the services that they are delivering, that can only go on for so long before it just isn't sustainable anymore. And so this is something that many, many people are, it is on their mind. It is something they're worried about because of the impacts it's going to have.
If you could give somebody an action to take to help address this problem, say, I don't know, maybe they live in the first congressional district down in southern Minnesota, what would you ask them to do?
I would say one is reach out to those who represent you. We have a representative in Brad Finstad who is, in lockstep behind this Trump agenda. And so I know folks are doing this and making clear their perspectives to him and his office. Reach out to him and be sure that he knows where you stand on this, whether that's a phone call or an email or a letter to the editor. And the other thing is talk to your friends and neighbors and family about this, to be sure that everyone in your circle sort of is aware of what is happening, what the impacts are, and who is responsible and what we can do about it. Because we do, as the collective, the people, we do have the power and the ability to speak up and to do something about this. And so it will take all of us to do that, though.
Awesome. Senator Liz Boldon, thank you for joining us this morning on the DFL Daily, and I appreciate all the work you're doing in the state Senate.
Happy to be here.